Welcome to the NTT Health and Wellbeing Podcast, a show exploring the digital transformation of our everyday welfare. On this episode, we know that cybersecurity threats exist throughout our day-to-day lives, but are we paying enough attention to how those threats could impact our health? Craig Hinkley, CEO of NTT Application Security, is joined by Beau Woods, a senior advisor at the Cybersecurity and Infrastructure Security Agency, to explore this question and break down the cyber battle to protect your health.
Beau, welcome today, and really appreciate your time to be with us and to share your experience. So maybe just for folks listening out there, if you could just introduce yourself and a little bit about your background.
Yeah, thanks, Craig. I'm really excited to be here. So my name is Beau Woods. I am a senior advisor with the U.S. Cybersecurity and Infrastructure Security Agency. Before that, I worked a lot in private sector, quite a bit in healthcare, spending a few years at a hospital. I worked for a year with the Food and Drug Administration, and I've done various other things in healthcare, public health, including some of the things on the more security research side, the medical device side, hospital side, just try and improve patients' lives.
Excellent. Well, thank you again. So glad you're here to be with us, to spend time with us today. So let's start today with just a question to set some context here for our listeners. So, Beau, often fears of cybersecurity compromises relate to sensitive data, passwords, account numbers, etc., being compromised. But when it comes to healthcare cybersecurity, you have stated in the past that the most vulnerable and valuable assets to protect is the patient's life itself. Can you offer background on this direct connection between cybersecurity and human safety?
Yeah, absolutely. I mean, that's one of the things that I think a lot of people are starting to realize, that we're seeing a convergence between cybersecurity, information security, data security, and its impact on human life, public safety, national economic security. And in healthcare, that means patients' lives. You know, one of my very first experiences working in a hospital was working on medical devices, ensuring that they were available to doctors and nurses to provide the best care available. And if you think about it, we've been working with connected medical devices, depending on who you ask, for many decades. We use connected medical devices to help physicians and nurses deliver care because we have clinical evidence, robust clinical evidence going back for decades, that these things save lives. They improve lives. They reduce cost of care. They improve quality of care, consistency. And so if those things are tampered with, if medical devices are taken offline, if they're not available, then you lose all of those benefits. And that means that you effectively, in comparison, you degrade, delay, and deny patient care. And so when you look at the kind of spectrum of types of harms that can come, data theft, intellectual property, or patient data is a severe issue, but even more severe and less recoverable is patients' lives. So one of the things that I've been working to do and through CISA and other outlets, and I know CISA has been trying to raise the alarm without being alarmist, is to recognize the higher consequences in critical infrastructure, particularly in healthcare, and particularly over the past year and a half or so during a global pandemic.
Thanks, Beau. And maybe a comment, because in 2017, the FDA confirmed that a St. Jude's medical implantable cardiac device had vulnerabilities that could allow a hacker to access the device. And the FDA reported that once in, the hacker could deplete the battery or administer incorrect pacing or shocks. The thought of someone giving me an unintended jolt to the heart obviously is not very comforting at all. So what are your thoughts on that sort of situation and how we should be thinking about that?
Winding back the clock a little bit from even 2017, in the early 2010s, you saw a bunch of security researchers going and working on medical devices. In many cases, they were medical devices that they themselves owned and were prescribed and used because they recognized that there could be security flaws in these connected medical technologies, connected healthcare technologies. Security researchers found bugs, reported it to the companies, and largely the companies didn't do a lot to address those. That was more than a decade ago. Things have changed since, but that kind of started the clock on the FDA, the medical device makers themselves, doctors and hospitals really increasing scrutiny of medical devices. In 2015, the FDA did their first effective recall. They issued a safety notification for a set of medical devices. The manufacturer kind of pulled them off the market and started looking at the rest of their deployed suite and found more issues. And so proactively started offering updates to those. But we're, as you kind of acknowledged, we're kind of new in this as compared with data security, information security, as we might think about it normally, which goes back to the 1970s. Some of the ideas of connected medical devices that can do harm, not from either being on or off or from data theft, it's fairly new, especially in the world of medical devices, where it might take 5 to 10 years to even get a new device to market. And if we've only really been focused on it, and the FDA has been putting out their pre-market and post-market guidance to medical device makers since I think 2013 or 2014 was their first of these new updated guidances, that's still fairly fresh. It's fairly new. So many medical devices have not yet been put onto the market that have been built, developed with this new kind of ethos. Even with devices coming onto the market, there's a very long timeline before devices that are in hospitals get cycled out. As long as they can still serve their clinical function, in a lot of cases, it doesn't make sense to replace them. So we might be dealing with some of the consequences of legacy designs, of some premature connectivity across the industry for a decade or more to come.
In your experience, why are these malicious threat actors targeting these specific systems and devices within healthcare?
It's a great question to talk about motivations and to think about motivations, particularly of the adversaries that we face. I like to say that no one's the villain of their own comic book story, right? No one wakes up in the morning and says, I want to be evil. I want to be really corrupt and just hurt everybody. Or at least the people that do, it's very, very few, a very small percentage. Unfortunately, when you look across the 5 billion or so connected people on the planet, even a very small percentage can make a significant difference. They can show up in a lot of places. But moving beyond just the sociopaths on the internet, you look at motivations of people who, maybe they're trying to get money, right? Maybe in the country that they operate in, these are not crimes. Now, they should be. I think most of people would agree that hurting somebody else for money should be a crime. But when they don't have to worry about criminal activity and getting arrested, it just becomes, for some people, a profit motivation. For other people, they may be trying to improve their own nation's status for various different reasons and with various different techniques. So, nation state adversaries come into effect. You may also have people like ideological adversaries, terrorists, who, we already know why they want to do us harm. That's beyond the scope of a cybersecurity podcast to talk about ideological motivations of fringe groups. But we know they want to do us harm. They only lack the means and opportunity to do so. And sometimes through cyber means, they can do so. But even going beyond people who are, the sociopaths or people who may have a motivation in their mind that's legitimate, a lot of times hospitals get hit by things that are not targeted at them at all. In fact, when I was working at a hospital, most of the cybersecurity incidents that we got, I would say all of them that I know of, were not targeted at us. They weren't targeted at healthcare. They were targeted at a particular operating system, a particular platform, a particular vulnerability in order to, largely make money. I remember one piece of malicious software was looking to steal banking passwords. And because it was exploiting vulnerabilities in a common operating system that was running on medical devices, common desktop operating system running on medical devices, they got access to the medical devices, and it was causing the devices themselves to just reboot all the time, right? So it wasn't malicious targeted. It was intended to do something different that had a side effect that was harmful to patients.
Thank you, Bob. What I hear you saying is that the healthcare institutions possess really so much information that's of high monetary and intelligence value to these cyber thieves, but also nation state actors as well. So Yeah, that's good for all of us to know and think about. So let's now turn our attention to the battle between good and evil. So what is the state of the ongoing cyber battle between the security professionals and their adversaries now as it relates to healthcare systems and devices? If security professionals are behind, how do we catch up and then overtake these malicious actors?
Well, adversaries in the last decade have gotten really smart, really capable. There's an effect that I call trickle-down hackonomics, which is that you tend to see characteristics and capabilities move from where only a nation state or the highest capability actor can do it. Within a few years, it becomes available for free on the internet to anybody who's looking for it, right? Tools keep improving, techniques keep improving, the ability to communicate and coordinate keeps improving. The criminal underground marketplace keeps developing its own robust set of capabilities that you can buy just off the shelf. So I think that offense in a lot of ways has improved faster than defense has. It's not that we haven't gotten better. It's that bad guys have gotten better faster. Particularly, I think in healthcare, where you're budget constrained, you may not be able to afford certain tools. Particularly when, especially during the pandemic, a lot of healthcare institutions had to rapidly shift to remote work. And that means you open a lot of holes in your firewalls, right? So that you can allow remote work to take place so that you can still continue to save people's lives. But if you're doing it in an environment, especially where you already have a lack of security talent, especially when you have to make cuts because you're not making as much money from elective surgeries and other procedures, you're relying more on money coming in from emergency type services for COVID victims. You see the economics just shift and go upside down. So I think across the healthcare sector, the struggle has gotten even more profound over the course of the last 18 months to even 2 years, with the defenders being on the losing side a lot of times. You see this again reflected in a lot of the ransomware stories, because ransomware is some of my CISA colleagues like to say, it's self-reporting, self-discovering malware. You don't have to go looking for it, it finds you. And so we've taken notice, I think, of a lot of the struggles that healthcare has had. Numerous reports from last year highlighted the impact to healthcare of cyber attacks as some criminals and others chose to focus more on healthcare, as we're seeing more of the effects that can't be missed, like ransomware. And so I think this is a time when healthcare providers and others need a lot of help, a lot of support to be able to improve and get better. And that's what we at CISA are trying to do to help them. And there are other groups. HHS has been great at putting out alerts and working with healthcare organizations, the FBI as well. A lot of our government friends and partners, as well as a lot of people in the private sector. As I mentioned earlier, a lot of organizations have stood up free, low-cost, no-cost services to be able to help healthcare providers, or to allow them to benefit from other programs that they've got that typically they aren't offering for-profit or nonprofit healthcare providers. They're now opening those up a little bit wider so that everybody who needs them in the healthcare industry can take advantage of them.
When the pandemic hit, and obviously healthcare systems, like everyone else, had to move to this kind of rapid remote work, but also how to respond in this new world called COVID-19 pandemic. A lot of companies had to accelerate digital transformation because a lot of the services now had to go online. They had to move a lot of what they used to do in person, maybe in the clinic or in the office or in the hospital, to digital and web applications, websites, and push everything online. And NTT Application Security did an analysis, and they found that 52% of the applications in the healthcare industry had at least one serious vulnerability. And for you understand that. For our listeners, that's a vulnerability with a rating of high or critical on the common vulnerability scoring scale. One of these critical vulnerabilities open for the entire year. So in essence, what that means is that about half of the healthcare systems, websites, web applications were kind of always vulnerable for the entire year. So how do you think the healthcare industry is responding to that digital transformation? And that's not just from the pandemic, but that's an overall business trend to put more and more online, connect patient with provider. How is the industry thinking through that and those types of exposures?
Yeah, one of the trends that we saw, particularly during the pandemic, is a lot more organizations, particularly healthcare, are putting more things online. So they're increasing their attack surface, we say. At the same time, because people couldn't get into the office, they couldn't do a lot of the routine maintenance, updating, upgrading that they would normally do, because you don't want to be in a position where you accidentally do an update, the system doesn't come back up, and it takes you 6 or 8 hours to get in and restart it, right? So an increase in attack surface, a decrease in frequency of updates, or to put it another way, an increase in mean time to address security issues, discovered security issues. Those two trends, I think, are undeniable, and they're ultimately reducing the overall cybersecurity of a system. We're starting to recover a little bit from that. And we've seen mean time to fix things among the organizations that we look at with some of our Sci-Hi scanning services, cyber hygiene scanning services. That mean time to remediate issues has been trending down over the last few months, which is a great sign. It means that people are fixing things faster. You also, I think, partly driven by the pandemic, you have, particularly in healthcare, an increase in reliance on things like telehealth. Used to be, telehealth, remote doctor services, those weren't reimbursed. But during the pandemic, no one could get into the doctor. We still had to have checkups, right? So we actually had new conditions put in where those types of services are being reimbursed by insurance, by Medicare, Medicaid. I expect those to continue. So that means that our attack surface will remain large and will probably increase. We just need to ensure that the degree of security that we put into those systems is commensurate with the risk that we have.
Let's pivot a little bit here, because in this battle, again, for us against these adversaries, at NTT Application Security, we preach that the responsibility for cybersecurity extends beyond just an organization's security team. Rather, it requires holistic support in healthcare systems and in protecting medical devices and the medical systems and applications that you spoke about. Who are the various stakeholders, and how can they help improve, enhance, or ensure security is taken and applied across the board?
Yeah, that's a great question. When it comes to motivating, to moving organizations, to galvanizing organizational will, everybody does have a role to play. It is a shared responsibility. And you can sometimes find help from unexpected quarters, right? I mean, like in many cases, well, in a lot of organizations, security might live under a different group, right? Maybe sometimes under operations, maybe under IT, maybe a peer of IT, maybe in healthcare, a lot of times it's the chief compliance officer lives under that. So, whoever you directly report up through, there should be aligned incentives and ways to align what good security practices you need to do with those motivations. So as an example, like compliance can be a big driver, but it can only get you so far. Legal concerns sometimes can get you farther. So if there are things like bad practices, your chief counsel may come out and say, well, this is a bad practice. We can no longer sustain it. And so you might find an ally in the legal department, where other times, they may not support what you want to do. In some cases, they may. You may be able to find allies, in different types of organizations, like with medical device makers and others, in the product security teams, in the marketing teams, or in the research and development teams, especially as things align more and more with FDA requirements to get a device on the market and to keep a device on the market. You'll find maybe surprising allies there that you've never worked with before. I think one of the key critical skills that we don't always look for in our security professionals, we don't always look for in hiring, is a sense of empathy. And this is something that I've been talking about for 7 or 8 years now with an initiative that I helped found before I came into CISA, where we want to lead with empathy. We want to first understand what other people are trying to do and how we can help them before we start talking about what we value, what we think is going to work. is a lot easier to build friends, to build allies, if you're aligned, if you understand what motivates them. If we all keep in mind that the ultimate goal of healthcare is a safer population, a healthier population, better patient care when they're at the hospital, I think it's a lot easier then to get on the same page. And maybe that means, a security project gets put on hold while a medical delivery project goes ahead. Or maybe it means, you look at what are the risks to patient harm rather than the checklist security steps, and you orient around that patient safety as your North Star.
Yeah, and I love this concept of the patient as the North Star, putting the patient at the center of the outcome, whether that's health, well-being, in this case, security, privacy, and how do we orchestrate that and create those priorities. On a final note, let's look ahead to the future. What are the stakes of this conversation as our technological dependence continues to increase?
That's a great question. It's a very profound question. One of the initiatives that I helped start up in 2013 was called I Am the Cavalry. It's a grassroots initiative from the security research community. And our problem statement was that our dependence on connected technology is growing much faster than our ability to secure it in areas impacting human life, public safety, national and economic security. And really it comes down to what we depend on is not dependable enough. And so we can either depend on it less or we can make it more dependable. I don't see a way backwards in our level of dependence. So I think your question is right on. We're going to continue to growing our dependence on these things in areas that traditionally have not had a dependence on connected technology. Smart devices are everywhere. They're proliferating, continuing to grow in usage and in popularity, and for many good reasons, right? They bring us a lot of benefits that we couldn't realize otherwise. However, we need to make sure that as we're designing, building, deploying, operating, maintaining, and retiring these things, that they're done with security, not as an afterthought, not as an aftermarket approach, but that it's built in rather than bolted on. If you look at the way that fire codes changed, particularly, you can go back to the Great Fire of London in the 1600s and see how before then we were trying to bolt on some fire safety things. It didn't work. So they went and built it in. We lost some of those lessons and had to come back to them in the 1800s, 1900s. And today you see a lot of the remnants of that, where you'll go to a lot of buildings today and you'll see the fire escape on the outside. Well, those are unsafe. They're rickety. They're expensive to maintain. They often don't work when you need to use them. But modern designs build in that fire safety. And often if you go by a construction site, the first things you see go up are these fire stairwells. And they go up all the way to the top of the building. And in a fire, those are the last things that get burned and that collapse. It reduces cost. It makes them way more maintainable. It makes them way safer. And I think we have to figure out what the equivalent of fire codes or building codes are for building code.
So actually, from your point of view, Beau, there is a lot at stake. As you said earlier, you don't want to be an alarmist, as hackers have certainly proven that they have no remorse in targeting healthcare organizations with ransomware attacks or similar damaging methods of compromise. So, however, I have confidence that as the hackers evolve, so too will our ability to predict, to prevent, and protect the healthcare ecosystem as it evolves. So cybersecurity is no longer just a business issue. It's a human problem. It's a human one. And us humans, and what I love is us humans, we have a tendency to find ways to not just survive, but thrive. And with people like you, Beau, helping and guiding the healthcare system, I'm confident we're going to continue to deliver great outcomes and great health outcomes for everyone involved. So thank you very much for being on the show today. Thank you very much for imparting such wisdom to us all. And again, thank you for your service and what you and your organization does to help protect all of us who rely on the healthcare system on a day-to-day basis. Thank you.
Thank you for listening to the NTT Health and Wellbeing Podcast. For additional resources and to continue this conversation, please visit www.global.ntt/health and well-being.